Good afternoon, everyone. Welcome back to another awesome interview with one of my friends, Dr. Odette Suter. How are you today?
I'm good. Hi, Pam. It's so good to be with you. And hi,
Hi.
Nora and Weir.
Nor.
There are some people in there as well.
Yes. Okay. And I want to give a shout out to Nor because she's the one who suggested this topic to talk with you because, and she told me I could say this, it's because Flocon, her precious kitty, has been working with you for this kind of issue. And so that was like, wow, that's a great topic. And it's not a very well known disease or condition. And like a lot of times, what I'm figuring out is it's missed, you know? So, first of all, for those of you who are watching, I wanted to say thank you for being here and drop a comment over in the comments and let us know where you're watching from because we love to say hello. And if you have questions during the show, drop them over here as well. We'll try to answer those as we go. And then I'm also streaming on Instagram, but we can't see comments. So just know that you can still watch, but we can't see your comments. So if you want to drop a question or a comment, come over here to our Facebook or our YouTube platform. So we're going to jump into this. This is really interesting. It is not the first time I heard of Plechner syndrome when Nora brought it up. Another client of mine a couple years ago said her vet suspected that her cat may have it, but it doesn't. It was never really in alignment. So they thought, well, maybe it was, but no, we don't think it is. So that's where I first heard about it. But can you talk to us about what is Plechner's syndrome? Let's start there. That's a good place to begin.
Yeah, that's a good place to start. Yeah. So Plechner's, Alfred Plechner was a veterinarian. He passed away a few years ago, but he basically realized that a lot of animals, cats, dogs, and humans actually as well, are having some recurrent issues that just keep coming back and keep not resolving. And
Mm-hmm.
so he obviously frustrated, as probably a lot of veterinarians are, having to treat the same thing over and over again.
Yeah.
He decided to do a bit of a deep dive and try to figure out what was going on. And basically, what he discovered in the process, he started with doing some immunological testing, and he discovered that the immune system was basically decreased in its function
Mm-hmm.
with animals that have this kind of syndrome. So he tested a lot of these sick dogs and sick cats that he was seeing, and they all had low levels of immunoglobulins, which are basically part of the immune system that help fight things and keep
Yeah.
things balanced.
Yeah.
Um, and then he continued to see, well, why is that happening and how is that connected, and he figured out that it was connected to the hormonal system, particularly to the adrenal glands and cortisol.
Mm-hmm.
And so he started treating these animals with low levels of steroids, like physiologic doses. And I'll get to that in a little bit because I know when people talk about steroids, red flags go up.
Yes.
They're like,
Yes. They're
nope,
like, nope, nope, nope.
no steroids, that's like the worst thing in the world.
Right.
They'll do all kinds of other things, but steroids, that's a big no-no. So I will address that because it is not, it's a miracle drug. And it's not just a drug, it's actually being produced by the body. So
Oh,
it's a
interesting.
hormone.
Yes.
But in
Okay.
any case, so he started treating these animals with low amounts of cortisol. And what he found is these immunoglobulins would go up, the
Mm.
animals would heal. They would feel better. All the skin conditions, the urinary tract infections, the
Yeah.
recurrent. I mean, there are a lot of symptoms that animals can have, and maybe I
Mm-hmm.
should start with that because that may connect the pieces with some of those who are listening. Because
Yeah.
there are a lot of symptoms, and I have a whole list here.
Yeah, let's talk about that because if you guys are watching or if you guys are catching this on the replay, get
Mhm.
your pen and paper out and start taking some notes. And if your cat is you check these boxes, start to create some notes that you can go back and share with your vet. So go ahead.
Yeah. Yeah, so symptoms of low cortisol, or diseases that are associated with low cortisol levels, are skin conditions. So that can be allergies, recurrent hot spots, chewing on themselves, ear infections, anything that has to do with the skin. And that would also include anal glands, which is not usually a huge problem for cats, but in dogs for sure. Hypersensitivity to fleas, autoimmune issues, cancer, can't read my own handwriting. Failure to respond to vaccines, for example. Not that I'm a huge proponent of vaccines, but I mention it. And then GI issues, inflammatory bowel issues. I don't really like the word inflammatory bowel disease because that's usually used as a diagnosis.
Yeah.
Where in fact it's just a description of what's going on. There's inflammation in the gut. And
exactly.
If your dog has, or if your cat has diarrhea or vomiting, they have inflammation in the gut, period.
Yes.
The end. Yes.
Yep.
So in any case, so anything happening in the gut, severe reflux I see sometimes, maybe more so in dogs than cats again, but just a lot of GI issues that just won't heal, diarrhea, vomiting. I remember a cat who was vomiting several times each month, and we treated him and he stopped vomiting. So vomiting, is obviously a big issue in cats.
Yeah.
And then they can also have some really strange behaviors. One of my patients, he hated to be touched because he just, I don't know if there was pain or hypersensitivity in his skin or something like that. So that resolved as well. He also had very big issues with focus and being interested in anything. That also changed with treatment. Vitality, obviously, if you have a cat that's just not moving and just kind of laying around doing nothing, even though they're still relatively young. I know they call like any cat over 10 seniors or even worse. What's the other word? Geriatric.
Okay. No.
To be able to live to over 20.
Yes.
So geriatric at 10, that's just crazy.
I agree.
That's like, we were talking about the dance world earlier, right? In dancing, if you're over 30, you're in the senior category. When I first saw that, for competing, I'm like, yeah, no, I ain't no senior.
No.
It's just insane. Funny. Yeah. Anyways, then all kinds of issues with infections, like recurrent urinary tract issues in cats, which oftentimes are not infections. They're usually more of the sterile type of inflammation of the bladder, but that can be part of it. Malabsorption in the gut as well. I should have mentioned that. Kidney issues, chronic liver disease, hypersexuality, obesity. I had a patient who was morbidly obese.
Oh, wow.
It was a dog. He weighed 40 pounds, and I was resisting doing hormones on him because his thyroid levels were sort of okay, and his his IgA was definitely low. But I'm like, cortisol and tends to actually make you gain weight, so it doesn't make sense. I put him on some cortisol and a little thyroid hormone. He finally started losing the weight.
Oh, wow. That's amazing.
Yeah. So treatment can really make a huge difference. And then, as I mentioned with cats, the stress urinary issues, premature aging, SARDs, which is sudden acquired retinal degeneration. I think that's more dogs too. I don't remember having seen that in cats. Fertility issues, which, for most cats, they're spayed or neutered, so maybe not a huge issue. Seizures, anorexia, fatigue, just overly susceptible to stress. You name it, it can fall into that category because cortisol is kind of at the center of it all. And cortisol is one of the adrenal hormones that, most people have heard of it. It's the stress hormone, right?
Yep.
And it's the major hormones. Some of the endocrinologists, they call it the queen of all hormones. And others will say it's insulin, but they all kind of play together. But in any case, hormones, and just to kind of give a bit of an overview of hormones, they are the chemical messengers in the body. So basically, they tell the cells when to do something. And so if you don't have enough cortisol, you don't have enough thyroid hormone, you don't have enough estrogen, whatever the hormone is, then the cells cannot really do what they're supposed to do because they're just not getting the signal. they're not getting
Mm-hmm.
the message. So they're like, yeah, well, I'm just gonna, you know,
Hang
wait,
out.
hang out and do nothing because I
Mm-hmm.
didn't get the signal. So then as a result, the immune system isn't working properly. The GI, I mean, all the systems just stop working properly.
Interesting.
And so, that can then manifest in all kinds of signs, right?
Yeah.
Because cortisol basically has receptors on pretty much every cell that I'm aware of. So if there's
Yeah.
not enough cortisol, then the liver can't function well, the skin can't function well, the gut, the brain, everything basically. And
Mm-hmm.
I myself have suffered from low cortisol levels because I used to have chronic fatigue syndrome, and my
Yeah.
cortisol was pretty much flatlined. And I'm telling you, I felt like I was dying inside.
Mm,
It wasn't just being tired, it was like an exhaustion that was way beyond not having
yeah.
slept well for one night or something like that. It was just a feeling like I can't move. My
Yeah.
body is basically disintegrating inside, and I'm dying. Um, so for example, if had to do stuff in the house, it was either I would be cleaning the house or I would go to the post office. But I would not be able to do both things at the same time. Or I would be sitting in my car. At the time, I had a little Honda Civic that didn't have power steering. So
Oh,
I'd be
yeah.
sitting and trying to park, parallel park. Not that I have a problem with the actual parking, but just having to maneuver that
Yeah.
like I'm maneuvering a tractor. And so then once I had done that, I would have to sit in my car for a while and just wait for a little bit of energy to come back. And, I would be
Yes.
watching people walk down the road and like, how can they do that? How is that possible? I couldn't, just watching
Mm-hmm.
them would make me feel completely, even more exhausted than I already was.
Yeah.
So that's basically cortisol for you. You know, um, if there's not enough
Well,
cortisol, it works.
let me ask a question. With all this myriad of symptoms,
Hmm.
have they figured out, like, what is there a common trigger that kind of sets the ball rolling for this IgA deficiency and cortisol deficiency? I know one person made a comment that and I don't know this to be true, but he said it seems like it's more common in animals who have been spayed or neutered. Is that just a misconception, or is there a trigger that they've kind of figured out that this is what causes this all the time?
Well, I think it's probably multiple triggers. For one, we live in a world that's very toxic,
Mm-hmm.
and that's being passed on from one generation to another. The toxicity from mom
Yeah.
gets into the milk and gets right into the kitten or the puppy or the whatever baby it is.
Mm-hmm.
Then toxins will also change epigenetic expression, so they basically turn
Yep.
on and turn off genes, and then
Mm-hmm.
that's being passed on from one generation to another. And then the puppy also gets exposed to whatever is in the environment, or the kitten.
Yeah.
So you have like exposure from all directions, and then for dogs and cats, on top of everything, you have inbreeding and line breeding, so that also hasn't helped. Obviously a lot of cats, particularly if they're, rescue cats, they probably mated with, there's a variety of genetics that are being passed along, but certainly with the purebred animals, there's certainly a bit of a higher prevalence, it seems like. But I've
Mm.
seen it in intact animals and neutered
Okay.
animals, so it doesn't really make a huge difference. And it probably depends a little bit too on how they were set up when they were first born. Did they get a lot of insults from antibiotics, dewormers, vaccines, all of these things, huge
Mm-hmm.
insults on the immune system, on the microbiome of the gut. And
Right.
then in you know in, as a result, also a huge influence on the immune system, because in the first few months of life, that's where the immune system basically is trained by the microbes in the gut. And
Right.
microbes everywhere, basically. They're basically training the immune system to recognize what's harmful and what's not harmful. So for
Mm.
example, chicken is not harmful, it's
Mm.
food, right? So
Right.
it shouldn't be harmful. Pollens that are out there are just pollens. They
Right.
shouldn't be harmful. But if the immune system is not trained to recognize that as non-harmful, it will start to attack it. So
Mm-hmm.
basically, that's a little bit what happens. And with all of that, the stress that comes from, early life, kitten being taken away from mom, put into a
Mm-hmm.
different home. There's always a lot of trauma that happens with really young animals, just because
Yes.
that's how we do it in this world.
Mm-hmm.
So all of these contributing factors are, piling up on top of one another. And then the diet, poor diet certainly doesn't help. Even if it's a great diet, all species appropriate raw, I mean, with all the nutrients in it, it may still
Yeah.
be deficient, just because if the cow that was slaughtered lived in a pasture that was selenium deficient, then the kitten will be selenium. It's not getting the selenium it needs. So it's just a multitude of things,
Mm.
that we've kind of done to this world that is contributing to all of that. Um, Low cortisol production, basically, and
Okay.
adrenal dysfunction. And basically what happens is when there's too much cortisol, because that's usually what people worry about. So I want to bring up that red flag.
Yeah.
So the red flag, with the side effects, the liver problems, the excessive appetite, drinking, urinating, etc., that's when you give high doses. But the body does not make high doses of cortisol. It makes just enough, right? Just what it needs. So
Mm-hmm.
if this is normal levels, if you give steroids, you're giving high levels, and then you see all the symptoms, of excess, and that's what we don't want. I'm
Mm.
definitely not a proponent of that unless they have some autoimmune condition that really, where we just need to cut it out, because otherwise
Right.
the animal is going to die. But it's the high levels. So if your veterinarian has ever put your cat or your dog or yourself on cortisol, and you start, they're drinking excessively, eating excessively, they're getting too much, and
Mm-hmm.
that's more than what the body really needs. So what we need to do is we need to just bring it to the normal level, because with this Plechner syndrome, there's just not enough. So if this is normal level, they're somewhere in between
Below.
that and Addison's. Addison's is basically where the adrenal glands don't function at all,
Mm.
and they don't make any cortisol at all. So in these animals, they will basically go into shock and potentially die
Yeah.
if you don't get any cortisol. So that's Addison's disease. That's basically where the
Mm.
adrenal gland, at least the cortisol producing aspect of the adrenal glands, and some others as well, but are they're basically eliminated.
Yeah.
Uh, and so, veterinarians, they recognize Addison's, but they don't recognize all of the levels in between, because
Mm.
you don't have to be full blown Addison's to not have enough cortisol, because there's a big
Mm-hmm.
jump from here to down here, right?
Right.
So with Plechner syndrome, what we want to do, we just want to bring it up to the normal level so that the body can function. We don't want to go
Mm-hmm.
high,
Right.
because that would be immunosuppressive or anti-inflammatory. We want to go to normal, where the body is. And, I use the analogy of thyroid hormone, because that's something that most people understand.
Yeah.
If you're hypothyroid, you want your doctor to put you on some thyroid medication so that you can bring the thyroid levels up. But no doctor will give you a dose of thyroid hormone that will bring it really high up so that you become hyperthyroid, right?
Exactly.
We don't
Yes.
do that. And so
Yeah.
therefore, nobody has a red flag about thyroid hormone, because there's nobody that puts you on really high levels. But with cortisol, because most dosages are so high, that's where that red flag comes from.
So
So
how do
when
they
I
go
go
ahead.
ahead.
No, I was just going to say, is there like a certain level? Like, how do they know what is normal then? Is there a pretty standard
Yeah. So
standards?
with cortisol, the problem is that cortisol can respond to stress immediately. So
Mm-hmm.
just doing a blood draw will change the cortisol level. So having a
Mm-hmm.
really accurate level of cortisol is going to be very challenging to do. So what Plechner has figured out is he measures cortisol levels, he measures estrogen levels, he measures thyroid levels, and he measures IgA, IgG, and IgM, I believe. So he measures multiple parameters to kind of get a whole picture, basically.
Mm-hmm.
Because
Mm-hmm.
what happens, and I should probably go back
Yeah,
And maybe I can share my screen here,
definitely.
because that will make it a little bit easier. Okay, I froze now, I think. All right, share.
There we're good.
Where's it? Share. Because it's a little bit more, it's not complicated, but I just want to. Are you still able to hear me?
Yeah, I can hear you.
Are you still able to hear me?
Yes.
Oh, okay. Okay, I was.
There we go. Here we go. Let's see. This we go. Give it a second. It should pop up.
Because I couldn't.
There you go.
There we go. All right. Are you? I can't
Do you want me
see
to make it
anybody
bigger?
anymore. So.
Do you want me to make it bigger?
No. No, I can't see you if I'm screen sharing like this.
You're fine.
But you can still see me?
Yes, I can still see you.
Okay.
And I can share the screen.
So anyways, so here you can see that's the adrenal glands. They live right on kind of next to the kidneys. That's why they call them adrenal. In any case, you can see that there are different zones here. So we have the cortex, which is kind of the outer aspect, the whole thing here, and then we have the medulla on the inside. So we have different zones here that make different things. So the zona glomerulosa makes aldosterone, which helps with water metabolism. And then the zona reticularis, which is a little bit further in, that's the one that makes the cortisol. But we also have one that's a little further in even that makes androgens, including DHEA, estrogen, and testosterone. And so what Alfred Plechner realized in his testing was that estrogen will go up a little bit when the adrenal hormone cortisol is low. And the medulla makes the adrenaline. So in any case, the signal for the adrenal glands to produce hormones comes from the pituitary gland, which is, from the hypothalamus, and then the pituitary gland that produces ACTH. So ACTH is a hormone that stimulates the adrenal glands to make cortisol. And so if there's not enough cortisol being made, then the pituitary recognizes that and starts to dump more ACTH in the attempt to get the adrenal glands to make more cortisol. But if the adrenal glands can't make cortisol, it's like trying to beat a dead horse, right? It just won't. But at the same time, we have okay, you can forget about that. But anyway, so we have negative feedback. So anytime there's enough cortisol or estrogen, testosterone, it will give feedback to the brain to stop. It's kind of like a thermostat. But in any case, if we don't have this negative, this negative feedback happening because there's not enough cortisol, then ACTH continues to be produced. And as a result, we have more of the estrogen that's being produced as well because it's being stimulated. So does that make sense? And so that's why he would be testing for other things as well, because I'm just checking if there's any other slide I need here. No, not really. Anyways, I'm going to stop sharing now. How do I do that?
Oh, I can remove it if you want.
Stop screen. There we go.
Okay.
All right. So did that make sense?
Yes. That was great.
So in any case, when cortisol levels are a bit low, then estrogen will be elevated a little bit. IgA, IgG, IgM will be low. Thyroid levels tend to also be a bit low, more so in dogs than in cats. And so then you have the whole picture and you can really see how it all fits together. So just relying on cortisol is not really enough. It would be enough if we have full-blown Addisons, because no matter what you're stimulating, nothing is going to happen. But if it's somewhere in between, the adrenal glands can still respond a little bit, but maybe just not as much as they need to. And so this in between is what gets missed, and that's where all of these diseases then can happen, because there's just not enough going on there.
So essentially, this is an endocrine system problem.
Yeah. I mean, the problem is obviously a bigger issue because of toxicity and all the things that I mentioned. But it is,
Yeah.
it comes down to being an endocrine issue. And so if you don't fix that, you can give them best of nutrition you want. You can do
Yeah.
all kinds of therapies. You can do whatever you want until the cows come home, and it's not going to change. So
Yeah.
you really have to get the hormones in balance in order to make any kind of progress with anything.
Mm-hmm. So how does one, if someone is maybe suspects that their cat might be dealing with an issue like this, would you recommend that they do a whole hormone panel? Like
Yeah,
what should they talk to their vet about?
yeah. So I would suggest that they, talk to their vet about Plechner syndrome first.
Yeah. Yeah.
Probably give them a book, because Dr. Plechner actually wrote a book, Pets
Oh,
at
nice.
Risk, where he
Okay.
explains things, and he has, a lot of explanations on how he treats and everything. I've adjusted it a little bit because I'm not a big fan of some of the, things that he's been using, but it's a really good book to share with your veterinarian. So get one of those and then share with your vets, so that they can
Mm-hmm.
read about it. And then I'm obviously always open to speaking with any vet who's interested, because that's the only way we can
The more we
really.
learn.
Yeah,
Yeah.
and I do find that a lot of veterinarians are a little bit worried about using hormone therapy. Um, they'd rather use things that are not made by the body, like Cytopoint and Apoquel and other things, rather than the actual hormone that is made by the body.
Right.
But in any case, just talking. And then the thing is that the Plechner syndrome testing is done by a specialty lab called National Veterinary Diagnostic Services.
Mm.
And so most veterinarians do not have an account with that lab, and so they would have to open up an account to do the
Mm.
testing and send the samples there. Obviously, there are other labs that would test estrogen, cortisol, and all of these things, but the reference ranges that he uses are really important as well,
Mm.
for that. And I've done some comparison with other thyroid labs, labs that test for thyroid hormones, but I haven't done any comparison with labs that do IgA testing, or
Mm.
the estrogens and such. So I just recommend just going with that lab. And if your vet is not open to it, I would just reach out to National Veterinary Diagnostic Services and ask them, is there a vet in my area who works with you? And then work
Yeah.
with that veterinarian, who most likely then also would be happy to prescribe the hormones, because again, a lot of veterinarians seem to be afraid of hormones and hormone therapy, and so
Yes.
they don't even want
So
to try.
they're testing the IgA levels, they're testing cortisol levels, or am I misunderstanding?
Yeah, I
They're
mean,
also testing all the hormone levels too.
yeah, you can do test all of the parameters that I mentioned, but I
Yep.
usually just do the IgA testing, and
IgA.
then thyroid depends a little bit on whether they had their thyroid tested in other ways,
Yep.
or not. But usually that's enough for me to know what's going on, because
Mm-hmm.
IgA, I used to do the full panel on all of my patients at first, and then I recognized that they all have the same pattern. If IgA is
Mm.
low, everything else
They're
is
all
going to
low.
be as expected. And
Mm.
so I was then only testing for IgA, just to save a bit of money as well.
Yeah. No, that makes a lot of sense because
Yeah,
it's,
yeah,
the layperson like us, we just don't know. So the more specific we can be with our vet and
hmm,
helping them know specifically what would give us the biggest bang for the buck, in terms of testing, it's
yeah,
always nice to go in with some knowledge. So that's awesome.
yeah.
Um,
But
so
there are some vets who may want to run the whole thing, just because they
yeah.
want to have a little bit of experience. They want to know and see for themselves. So
Hmm.
if your vet says, I want to do the full panel, don't say no.
Yeah.
Um, go with it, because if they're willing to do it, that's a big win.
That's awesome. So is this syndrome a lot more common than people really think?
Yeah, yeah, yeah.
So
I mean, hormones are usually the missing piece in most of what people do for their animals.
yeah.
They look at all sorts of things, They do all kinds of sensitivity testing and all that, but it's usually the hormones that are missing.
And remind us again, where are hormones made in the body?
Well, everywhere. I mean, we have the pituitary, the hypothalamus that basically produces, it's like the main hormone gland that basically secretes stimulating hormones. So, it stimulates the pituitary gland then to stimulate all the other glands as well. So we have thyroid gland, we have adrenal gland, we have pancreas that makes insulin, we have the gonads, ovaries, testicles,
spleen.
I think the spleen doesn't make hormone.
No.
Well, I mean, a lot of tissues make hormones locally for their own tissues, but they are not considered like the main hormones.
Right. So Christina says, can you test for elevated ATCH? Something you would do?
Well, it's done in horses particularly. I mean, I don't know that it's really being done in small animals, but in horses they do it because they tend to become cushingoid, so they make too much ACTH. I guess you could, but usually it's not really. I don't think it's done much. I can't think of it.
Yeah. Okay. Well, good to know. Okay. Yeah. So is a situation like this, like, let's talk about how you would treat it. So we've done our diagnostics, we've gone through all the symptoms, we've determined that IgA is really low. What would your plan of attack be?
Yeah. So I start them on a low dose of steroids. So depending on the IgA level, if the IgA level is below 58, I will start them on a transdermal prednisolone or an injectable hydrocortisone, because according to Al Plechner, they don't really absorb the steroid orally, via the GI tract very well if their IgA level is that low. So I will start them with a, transdermal or injectable. Right. And then once their IgA level comes up to a, more acceptable range, then I will switch them over to an oral form of it. And I usually use hydrocortisone because that's bioidentical, but you can also use prednisolone. Cats, prednisone is, doesn't really work so well for cats because they have to convert it to prednisolone, and they're not very good at that. So, if you're at the point where your vet is like, yeah, I will give you prednisolone because I have it, go for it, but I prefer the hydrocortisone.
And that is something the body recognizes, you said. It's a bioidentical hormone.
Yeah, I mean, it will recognize steroids, other steroids as well.
Okay.
It's just that they're the synthetic version. But
let's talk again about what we were talking about earlier. Some people get really turned off when you mention the word steroid. So can you talk about the dose level and what that, how when you say a low dose, what does that look like for people so they don't get all freaked out?
Yeah. So with hydrocortisone, a low dose is 0.5 milligrams per pound once a day. And so usually the anti-inflammatory dose is at least twice that. And then the immunosuppressive dose is more like 4 times that.
Oh, okay.
Yeah. Okay. So it's really, really high.
Yeah.
And then with prednisolone, it's 0.125 milligrams per pound.
Okay. Very interesting. So it is a very tiny
because the strength is different.
Yeah. Now, is there
it's a tiny amount.
Risk? Is there a risk for being on it too long? On a low dose?
Not that I've seen. I mean, I've had dogs and cats on it for years, and they did fine. They actually lived really good lives. Instead of being on this constant downhill slope, they feel good, and then eventually, when it's their time, they just die. So they're doing well. Yeah.
Okay.
No, I haven't seen any issues. No kidney, no liver issues, because that's usually something people worry about. No muscle loss. No, none of that.
Oh, good. Okay. But it's not like you would never give a healthy cat a low dose of steroids if they don't need it. I mean,
No, no,
that
because
would
that
be
would be too much.
yes, that
The
would
body,
raise it. That would be the past the normal, and
yeah,
that's where you get into problems, right?
yeah, yeah, yeah. So you don't want to get into that zone, and that's what I use the side effects as a guide, because if an
Mm,
animal starts to drink and exhibit signs of too much, then I know we're a little too high, and then we will drop that dose. And I
yeah,
will also start at a dose, because every animal is a little bit different on what they
yeah.
need. And then I will slowly increase it until they have side effects, and then I will drop it to the dose right below, because that
Okay,
tells me this is where it needs to be.
yeah.
So I use side effects as a guide to know whether it's too much or too little for
And
that particular individual.
how long does it take for this to fix itself or regulate once you've got the right dose? How long before you start to see those IgA levels come up and then like the symptoms stop?
Yeah, so I usually retest them about 2 months later, just to see where they're at, to see if we're kind of hitting that range. But I know Al Plechner, he would test it 2 months, 2 weeks later, but he used to use a little bit heavier drugs, like
Hmm.
that really stays in the system, and some other injectables. And I have not had very good experience with those, so I don't use those. And in most cases, it's not like it has to be turned around overnight. There's we have time. It would be more for dogs that have that SARDs, the sudden retinal
Yeah,
degeneration going on, that you'd have to really get it done ASAP, because if you want to save any kind of vision for them.
yeah.
But
Interesting.
yeah, otherwise not. But and then there's a small percentage of, I mean, most cats need a little bit of thyroid hormone. Sorry, most dogs need a little bit of thyroid hormone as well. But only few cats, maybe about 10% of cats, will need a little bit of thyroid hormone as well,
Interesting.
to
Okay.
just help with the metabolism of the
Yeah.
cortisol.
Interesting. Okay.
Yeah.
So let's fast forward. Let's say you have a cat and he's been on this protocol for now like I don't know 4 months or whatever, and his IgAs are looking great and he's asymptomatic. Can you stop the pred or is this a lifetime program?
It's usually a lifetime. Yeah.
Okay,
So I
let
just I keep them on that dose that is working well, and then I recheck them once a year, just to see where they're at, just to monitor.
yeah,
I have to say, I mean, obviously the hope would always be to be able to take them off of it and their system to start working
yeah,
better on its own. But so far, I've only seen one animal where that happened, where we took him off of it, and that was that obese dog that I was talking about earlier. So it
yeah,
probably was just kind of restoring things for him.
yeah.
But every other case I've worked with, they stayed on for the rest of their lives.
Interesting. Okay.
Mm-hmm.
Now, here's another thought because you brought this up earlier, like all the myriad of potential causes of things going wrong in the body with the toxins, the vaccines, the flea tick meds, the air, the
Mm-hmm.
all the stuff, all the toxins and stuff. So if a client is going meticulously and they're working cleaning up the diet, they've cleaned up their home and their environment, and they don't do the vaccines anymore, and they don't do the flea tick meds. So if you do your darndest to like eliminate all the potential toxin exposure that can contribute to damage like this, is it possible that the body can then reset over time? Or do you think, if it stops getting bombarded with all the stuff that was knocking it out of balance, is there a
Mm-hmm.
possibility that it can reset and maybe you can cross fingers? Maybe they're like the dog and it's like, you know what? My body's happy now. Or is
Mm-hmm.
that something you just keep monitoring?
Yeah, I don't know. I can't say that I've really had much, experience that way, in the sense of taking them off of it, because all the people that come to me, they're already doing all of what you're saying.
Okay, good to know.
So it's I mean, maybe with a dog who is on a really crappy diet, and everything is not, organized, but most of the dogs
Hmm.
and cats that I see, they're already doing that, and it's not working.
Okay. Okay.
So they may just be the canaries in the coal mine where, they're just,
Yes.
all of the issues, and basically reflecting back to us humans what we've done
Yep.
to this world and how things are.
And what we're being exposed to.
Yeah.
Because they're the canary in the coal mine in our homes, showing us like something's off.
Yeah.
It's
Yeah.
affecting me, so it's affecting you.
Yeah.
Which is
Yeah.
good for people to realize. Okay,
Yeah.
that's
Well,
very
and
cool.
I don't know if you're familiar with the Pottinger cats.
Yes.
Just for those who are not, the Pottinger, he collected a bunch of cats because he was using them for people
Experiments.
therapy. In any case, he had a bunch of cats, and some of the cats were on a raw fed diet, and others were on a cooked food diet, and that was in the 1940s, where even the cooked food diet was much higher
Right.
quality than whatever we can find. But
Yep.
what he saw is that with each generation, the animals, the cats were developing more and more issues, up to the third generation where they were basically infertile, so they weren't actually making a fourth generation. And then he tried to reverse that, see how long would it take to reverse the damage that was done. And so I think it was cats who had been on a cooked diet for one generation, or was it the second? I can't remember. But in any case, when he tried to reverse it, it took 4 generations just to get them to somewhat where they needed to be. And I think that would kind of explain or answer your question about can you take them off? Probably not, just because the damage that was done over generations cannot be reversed in one generation.
Yeah.
Okay, so I'm thinking that may be a big part of it, that the damage is probably so significant that it just can't be reversed in that one generation. Maybe if we were to continue breeding this particular animal and then see if we can get it to see what happens in the next generation type of thing.
Yeah.
But I don't think anybody has done that.
Well, and that makes me think of the whole genetic component. Do you think there's a possibility that some of these animals that develop this do have a genetic predisposition to develop it?
I mean, it seems, at least in the dogs that I've seen, that dogs that have more of the white coloring and, like the blues from the, what are they called? They look gray, but they have more of the blue gene in it. Anyways, big dog. I can't think of the name. Oh, Weimaraner.
Oh, okay. Yeah.
For example, or just dogs that have more white on them seem to be more susceptible to these types of things as well. I don't know about cats. I can't say that I've worked with enough cats to be able to determine that.
Right.
But certainly there's probably a genetic predisposition there, but it's not what's causing it.
Right. Well, when you think about the lifespan of pets in general compared to us, it would be like they have like 5 of our life. Their lifetimes would be like 5 times what ours would be, or something like that. So they're not living here long enough to be able to probably track that, right? Versus we have a whole 80, 90 years that we could look back and look at the genetic changes, but they're just not here that long.
Yeah. And that's probably also why we can't quite turn things around either, because things are happening much more rapidly in our animals' bodies, just because they age much more quickly than we do.
Yeah, exactly.
Yeah.
Okay, so I'm going to check my little notes over here. So you've told us that they can be healed completely, but they're going to have to pretty much stay on some kind of a treatment program for a lifetime, correct?
Yeah. I mean, it's like people who are hypothyroid, they are usually on thyroid replacement for life, or, women who go through menopause, if you decide to go on hormone therapy, that's going to be for the rest of your life as well, because you're trying to replace something that the body just isn't making. And it so happens that cortisol is a very important player in the body to make it function properly.
Right. And that doesn't mean go stress yourself out. because it's a stress hormone.
Yeah. I mean, definitely stress plays a huge role in it as well. I mean,
Mhm.
all of these cats, for example, who do pretty well at home, and then so you go on vacation or you take them to the vet, and every time you do something like that, they end up with a urinary tract
Yeah.
issue. That it basically is a sign that when everything is sort of calm, they have enough cortisol. But as soon as something goes awry, they don't
Um,
make enough cortisol, and then they get all inflamed.
Interesting.
So
Yeah.
those are like would be the typical ones that they're just kind of like under the surface. You just can't quite see it, but it's there. And then you add a little bit of a stressful situation to it, and then your cortisol level just kind of evaporates. you know it,
Oh, yeah.
um,
That's
because, for
interesting.
example, in animals that have Addison's disease, if there's any kind of stressful situation, you will double up the dosing on that day because they just need more. Because
Yeah.
the body's cortisol level is not always the same. It will vary depending on what's needed. It will also vary during the day. Like, for example, in humans, cortisol levels are highest in the morning and then they start to drop. So that by the time evening comes around, we can sleep. Uh,
Hmm.
Animals, it may be a little bit different, especially in cats, who have, they're more nocturnal. So the,
Right.
the
They
fluctuations
sleep
may
more
be different,
during the
but
day.
there's fluctuation, depending on what's needed. If there's more
Mhm.
stress, then you will need, the body will just make a little bit more. So, treating it with cortisol or, steroids is never going to be as good as what the body can achieve. But
Right.
still, it's far better than not having enough.
Yeah, that's true. That's true.
Mhm.
Okay, so I'm looking over here in the comments. Nora has just been so kind with so
Mhm.
much praise for you, Dr. Suter. She's
Well, she's
truly
amazing
a big
herself.
fan. Yeah, yeah. Um, do you guys have any other questions about Plechner syndrome or any other questions related to what we've talked about? If so, drop them over here in the comments. And I guess, as we kind of put together some final thoughts, do you have anything else that we kind of left off that would be important to share?
Yeah, well, I guess one of the things is, if in doubt, test for it. If you have a chronically
Yeah.
sick animal, then do test for it, to see if that's, the issue. And then one thing that I was reminded of as I was going through my notes, that even if you have a cat that's hyperthyroid,
Hmm.
check as well. I can't say that I have, uh,
Yeah.
which I know for some reason I probably missed that part, even though I wrote it down somewhere and forgot. But do test for that before you do something to the thyroid gland
Mm,
to see if there's something going on. Because what we need to remember is that all these glands really communicate with each other.
yeah.
If there's not enough cortisol, then the thyroid gland will probably shut down a little bit too, because it doesn't want to overdo it. So there's like mechanisms in place that really help. So no hormone is really is not on its own. They all work with each other. They all communicate with each other and adjust, depending on
Yeah.
what's necessary.
It's like the thermostat in your home.
Hmm.
It's a system that's
Yeah.
communicating and has all these sensors. And
Hmm.
so when there's something fluctuating, it's a little off, it either shuts on or it shuts off, right? It's
Yeah.
constantly monitoring everything. So
Mhm.
that's very interesting. So any last words of advice? I mean, that was great. Get your testing, check hyperthyroid. Is there
Mhm.
any other final thoughts before we wrap up? This has been amazing.
Um, yeah, just be persistent too if you run into any issues with, cooperation with vets. Just be persistent and, find a way to work. And, I'm always more than happy to also chat with people. And, I have my whole program as well, where I
Mhm.
use basically a strategy that involves hormones. And so I do offer like an assessment call. And so if that's something, we can certainly do that, and then see if the hormones may potentially be an issue.
Yeah.
in the picture, but very often it is. Most of the animals or people I speak to, they have animals that have issues with hormones that aren't looked at, so it's a big problem
Yeah.
nowadays,
So I do have one
and
other, I just,
underexplored.
yeah, I do have, it just made me think of something else. All the list of possible symptoms. What if your cat just has one of those? Is it likely, or is it like check most of the boxes or 50% of those boxes? Like, what's your thoughts on that?
Well, I mean, usually anything that's chronic doesn't resolve, doesn't get better, you know,
Hmm.
that definitely would be a reason to check, basically, no matter what it is.
So, and in this particular case, do the IgA test just to
Yeah, or
see,
the
or
whole
the
thing.
harm. Okay.
I mean, it doesn't have to be just the IgA. I mean, it depends on your vet on what
Yeah.
they want to do, but certainly it would be a good start. And it has to be with the National Veterinary Diagnostic Services.
Yes.
Because I
Okay.
don't know how the other IgA tests would relate. For example, there's a lab who does IgA testing on fecal matter, which is a whole different story. So,
Yeah.
because IgA levels in the gut can be higher when there's inflammation going on,
Yep.
because IgA is basically an immunoglobulin that sits on all the surfaces that have a connection to the outside world. So the skin, the gut, the mouth, the eyes, the ears, the nose, the bladder, the lungs, all of
Yes.
these surface
Okay.
areas have a lot of IgA. And I'm suspecting that when there's inflammation somewhere, a lot of that IgA is probably going to that inflammation. And then as a result, there's less IgA floating around in the blood. I
Okay.
can't prove that, but
Yeah.
as we're talking, I'm thinking, maybe that's why. Because I've always wondered, why is there more IgA in the gut, in
Hmm.
animals that are inflamed, because usually there's a low IgA level in the blood.
Interesting. Yeah, there's just, it opens more cans of worms, right? Just
Yeah,
more
yeah.
thought-provoking questions, and
Hmm.
if someone were going to do some research out there, that would be something to consider looking
Yeah,
at.
yeah.
Yeah, that's
But just
awesome.
overall, supporting the adrenal glands is just important, and that can be obviously through good nutrition, through good
Hmm.
gut health, because we want to not overstimulate the immune system. Because when you have leaky gut, then you're basically stimulating the immune system that sits right on the other side of that one layer of cells
Yes.
in the gut, and then you basically end up with inflammation everywhere, and inflammation everywhere will also affect the adrenal glands. So
Yep.
just decreasing that is important as well. But generally, those who come to me, they're already so inflamed that there's really, we have to go the hormone route. But if you have a dog who's not, or a cat who's not quite that bad yet, and you fix some things and see where you get with that, that's fine too. And then food sensitivities can obviously contribute to that as well, microbiome
Hmm.
imbalances. And then, obviously I always do a little bit of detox as well.
Yep.
And then also look at, what's the nervous system doing, because the nervous system is basically the counterpart of the hormonal system,
Yep.
because it basically creates communication throughout everything via electrical signaling,
Yes.
through
Yes.
the nerves.
Hmm.
So that part isn't working properly, then nothing else will, because even the hormone glands are innervated by the nerves, and
Exactly.
it basically then tells the blood vessels in that hormone gland to either dilate or constrict. And so optimal blood flow is obviously necessary for these glands to work properly. So you can have a
Yeah.
big effect on the thyroid gland, the adrenal glands, and so on, just by doing some chiropractic work.
Yeah.
For
Yeah.
example, if I feel a bit low energy, my chiropractor will always check my thyroid and see, is there like an innervation issue, and then
Hmm.
is that, and I have a bit more energy. So
Yeah.
it's not always hormones necessarily that can affect the gland. It can also, or that can decrease. Well, it can also be the nervous system basically that can assist or decrease the
Yes.
production of hormones.
Yes. That's so true. That's
Yeah,
so true.
yeah.
Well, this has been fascinating. Where can people find you if they want to learn more about what you do?
Yeah, they can find me. I have a website, OdetteSuterDVM.com. But if you just put in my name, I think it's
You'll find,
not
you'll
that
pop up.
many of me. Yeah.
Yeah.
Yeah. So I have a website, Facebook, Instagram, YouTube. Um,
Okay.
yeah, the usual.
Fabulous. The usual. That's
Yeah.
awesome. Okay. So you guys, if you're not following her already, definitely do that. Dr. Suter, thank you so much for educating us today. This has been super informative, and I hope it's going to maybe turn on some light bulbs for some people who've been struggling with some chronic stuff that they just haven't been able to resolve,
Yeah.
and they've done everything like you were talking about, your clients. They've done all these things and they're still, hitting a wall. So,
Mhm.
um, hopefully this will help a lot of people, like give them just something new to go talk to their vet about,
Mhm.
you know?
Yeah, yeah, because
Yeah.
it can really be the key to changing your animals' lives. So,
Absolutely. Well,
yes,
awesome. Well,
definitely.
you guys have a great rest of your day and happy Thursday to everyone. And we will see you again next time for
Yeah.
more
Thanks,
fun.
everyone.
So thank
Thanks.
y'all.
Bye-bye.
Bye.